Hi, my name is Jen. I'd like to do a quick video about how we treat trauma in children and teenagers. There's a few different sort of trauma modalities out there. If you name it, I've read the book, went to the training. There's a lot. There's a lot. All of them will argue that their way is better than somebody else's way, right? And in fact, I feel like the first PowerPoint slide at all of the trauma trainings I've ever been to is bashing the other theories, or them telling you why theirs is better than somebody else's. I tend to not be a black and white thinker. I tend to see children and teenagers with a variety of trauma experiences, and let's just figure out what this kid needs. But I'm going to tell you about a couple that I've been trained in, if that's okay. One of them, I'm nationally certified in trauma-focused cognitive behavioral therapy. A lot of people have heard about CBT, cognitive behavioral therapy. It's a little bit different. It's for children up to the age of 18. So it's only a treatment for children. And it has a few different components. And some of it's really, really good. Identifying feelings, identifying thoughts, and of course, being a play therapist, I do this in a fun way, right? And then part of trauma-focused CBT is allowing the kiddo, allowing the teenager an opportunity to tell their story. It's called a trauma narrative. They can do this in a variety of different ways. It can be a painting, it can be a collage, it can be typing, it can be a comic book. Sometimes older teenagers just prefer to, sit at my laptop and just type it up. That's fine. And then once they do that, they have the opportunity to share their trauma narrative with a supportive caregiver of their choice. So they can share it with mom, they can share it with dad, they can share it with a foster parent. And I give them a choice, but I meet with the person they chose and read through the trauma narrative and make sure that person is prepared to hear it and be supportive when the kiddo chooses to share it with them. So that's TF-CBT. It's a very well-researched program. It's been around for a number of years. Medicaid and some of our social workers are very well aware of that. And you'll also hear judges sometimes recommend that when there's a court case involving sexual abuse. The second one that I'm trained in that works is EMDR, eye movement desensitization and reprocessing. Yes, that can be used with kids. I'm going to make it dizzy, but I even have this little strip over here on my wall. There it is. That allows kids to sort of rank the level of a negative thought and the level of a positive thought. Even if a social worker, a parent, or a judge requests TF-CBT because it's really well known, that's fine. Part of the TF-CBT program is working on coping skills and helping kids and teenagers cope with what we call trauma reminders. So hearing someone's name, seeing a certain commercial, hearing a certain sound, and them being reminded of their trauma. So TF-CBT works on coping skills, and EMDR does also. So sometimes I'll integrate the two with each other. So in TF-CBT, when we're learning our coping skills, I'll teach kids a technique of EMDR, of developing a safe, calm place. What else do I sort of integrate? EMDR also teaches kids and teenagers a box or a container of how do I put some of those thoughts and feelings and memories away in my brain until I'm prepared to deal with them, process them, cope with them. So sometimes I'll teach my TF-CBT clients the container technique with EMDR. EMDR works a number of ways. It's just a series of eye movements which can be done any different way. They call it bilateral stimulation, so it's engaging both sides of the brain. Whatever trauma treatment you decide or you're seeking, I can meet with parents and I sort of explain them TF-CBT and EMDR. I have lots of handouts I'll go over with parents and they can make sort of informed choice, or if they're okay with a little bit of both, a little bit of both. As always, I offer a free 15-minute phone consultation if you want to call me and make sure I am the best fit to treat your child or teen who has experienced trauma. Currently, right now, with the filming of this video, I am accepting clients from the state of North Carolina. That's where I hold my license. And I'm in network with Blue Cross Blue Shield, Aetna, and MedCost, although some people just choose to pay privately and seek reimbursement from their insurance company. Give me a call, shoot me an email. You can visit my website if you have any questions, jennlowe.care.